Hey, good afternoon, everybody, and welcome to this presentation by the ESF, the release of our residential wellbeing program pilot report, which I'm personally very excited about. And for those of you who know how passionate I am about this program, you will understand that. Now, I believe that we've got people from across the globe joining us today. We're expecting some people from Canada, UK, USA, and New Zealand. So hopefully the time difference has enabled them to join us. So I'd like to begin by acknowledging the Boon Wurrung people of the Kulin Nation, who are the traditional custodians of the land and the beautiful waterways down here on the Mornington Peninsula, although it's a bit grey today, where I am, and pay my respects to elders past and present. Storytelling, of course, is a deeply ingrained cultural practice as a vital way of learning and teaching. And storytelling was a key aspect of this residential wellbeing program. And I want to begin by providing you some context about the program. So I'm assuming everybody can, and please add any questions as we go along in the chat, and we will be able to answer those along the way. So I've called this A Vision Unfolds, and you'll see why. I'm going to go through and tell you how long it's really taken us to get here today. And really, this story begins when I was back at CFA, where I had personal lived experience of the Linton fires. And unbeknownst to me, I was deeply affected by the vicarious trauma of those fires. And when I left CFA, I took myself off to a wellbeing retreat. Because I just thought that this was something that was going to be good for me to help me heal. Many years passed and I ended up at the Emergency Services Foundation. And at that time, I came, I suppose, with a bit of a vision that we could do something like a wellbeing retreat. And I remember talking to the board at the time about that. And in fact, Graham, I remember standing in Collins Street having a conversation with you about this outside number 20 Collins Street when we were there. And what happened as a result of that was that Graham then introduced me to Greg Dean from Victoria Police. And Greg had just done a Churchill Scholarship where he'd been overseas having a look at sort of retreats for police. And when he came back to VicPol, Graham said to him, well, this is great, Greg, but it's not something that VicPol should or could do on their own. It needs to be a sector-wide approach. And Graham then introduced Greg to me. And what happened was Greg went on and got an ESF scholarship where we said to him, and the board had had some conversations at the time, and we said to him, go off and have a look at what exists in Australia that we could use for a wellbeing retreat. And Greg went off and did that. And what he found is that we really needed to do something that was more tailored to emergency service people. He met emergency service people along the way. And, you know, that started a bit of a journey for us. So what happened was we invited the CEO of the UK Police Treatment Centre over here, and he was someone that Greg met in his Churchill Scholarship to speak to people. And this was really the first time that the leaders in the sector had been exposed to this idea of a retreat. And they thought the idea wasn't bad, but they didn't think the model that Patrick presented was going to work here in Victoria. And they basically said to me, go away and think about it a little bit more. So we went away and did a whole lot of literature reviews, and we did a whole lot of work with the Learning Network and started to think about what something might look like. And in the process of doing that, we met Professor Duncan Shields from the University of British Columbia in Canada. And he had been running a program over there for 15 years with the military. And then he was approached by the British Columbian Professional Firefighters Association to do something for them because they'd had a spate of suicides. And Duncan quite rightly said to them, well, I'm not going to pick this program up and deliver it to firefighters. We need to work together to tailor a program specifically for emergency services. And that's what they did. So they had a program over there that seemed to fit what we were really looking for. In 2022, we began fundraising, and a couple of firefighters went off to Kokoda and they started fundraising for us. And then we just did a whole lot of stakeholder engagement where Duncan Shields was out here in Australia and Steve Farina from the Firefighters Association and someone from New Zealand who had a different model again spoke to people here. So we were just gradually building up, I suppose, understanding and momentum of what we were trying to do. And we determined after Duncan's visit that the program that he ran was the model that we really liked. So then in 2023, Tony took off around Victoria and started raising some money for us. And that was that enabled us to speak about what we wanted to do as well. And on the back of that, when he arrived back at the MCG, we had a big function, and that's where we were able to speak to a whole lot of external stakeholders and got their interest. And off the back of that, on that day, we were able to excite WorkSafe to get involved in the program, and EML, the insurance agent, came on board as well. So we did a qualitative study with Right Management to understand the needs and expectations of potential participants. We developed a really comprehensive business case for the board. And then the board in August 2023 approved that business case. And not long after, I went over to Canada to work with Duncan and Steve to understand the back end of the program that they were running over there. What were all the administration processes and so forth that they used? And I met a lot of people over there who'd been on their program, and it really excited me more and more because I could see the benefits of the program for them. Shannon went soon after me, and he participated in a program as a co-facilitator with Duncan with a group of police. So he then got to train the trainer of the program over there. So after that, we established a board governance committee to help us oversee the implementation of what we were doing. And we began recruitment for the program in February last year, and we appointed Phoenix as the people who are going to evaluate the program for us. Then we had our facilitators, and we signed an agreement with Duncan and the University of British Columbia because we used the fundamentals of their program. In June, we began our pilot programs, and we did 6 pilot programs between June and October. And then here we are in May 2025 with the evaluation report. And we'll explain why there was such a time gap in that evaluation report. So in terms of the program, and just to give you a bit of why we did this, is basically we have a problem. And that problem is that our sector accounts for nearly 1/4 of all the mental injury claims received by WorkSafe. So what we were looking for was a really new and innovative approach to early intervention. And I talked about my own lived experience. And I really didn't know that I had vicarious trauma for more than 20 years. But if I had been able to process what had happened to me after Linton, I'm sure that I would have been a stronger, happier person for those intervening 20 years. I was functioning quite well. And I was a classic of what we called our target audience for this group was the walking wobbly, or the people who have crap in their backpack, but they're still able to function. They're not off on work cover, but they're carrying stuff around with them all the time. And what we saw was that there was a big gap in service delivery for this group of people, because there's a lot of things going on in the treatment space, rightly so, and then organisations are doing more and more up right in the sort of education and prevention stage. But what we have got is a huge cohort of people who have been in the emergency services for a number of years, who are carrying that stuff in their backpack, who need time to process. And what we wanted to do is to give them a safe, lovely space and time out. So we targeted people in what we call the orange zone on the mental health continuum. And the aim there was to prevent the transition to more serious mental harm. That's who we were looking at in our group. And the intake assessment was really, really critical and very, very thorough and very, very private. So we actually set up a clinical management system to do that. I never saw any of the data that came in. And what we did was we had psychologists work with these people. So they did a survey at the start, and then the psychologists worked with them to assess that survey to get a score for them. And if they were deemed suitable clinically, then they went to another interview, which was really about program suitability, because we needed to know that they were suitable for a group setting. We needed to know that they could come away for 4 days and not be dying for a drink because there was no alcohol. We needed to know that they didn't have a physical injury that precluded them from sitting around for long periods of time, because that's what happened. So that's what our psychologists really did, that assessment where they weighed up the clinical information with the personal suitability. And that's how people came into the program. And all of these people who came into the program were self-nominated. So they were either received information from their organisation saying, here's an opportunity, we support you, or they saw our social media posts calling for people and they came in that way. But they were essentially self-nominated. Nobody was tapped on the shoulder to come into this program. So we had 6 groups of 8 people. I originally wanted to do 10 people. And when Shannon came back from Canada, he said, no way can we do 10 people over 4 days. It's just not going to work. We can only manage 8 people at a time. So we ended up having 6 groups of 8 people. And what was different about, a big difference about our program to the Canadian program, is that when people signed up for the program, they had to nominate a support person. You remember I said we did our research about what participants were looking for in the program? That was directly related to that. So we drew that from that study. And so the whole intent of them having a support person is that they would have been in 4 days of very intensive environment where they felt very safe and supported. And then they were going home and they were like a fish out of water potentially. So we wanted everybody to have somebody who fully understood what these people had been through on the program. And so those support people were supported too. And we provided them a video information explaining what people were doing on the program and what to expect when people came home. So as people left the program, we emailed the support people again and we said to them, they're on their way home. This is what you can expect. And this is how we suggest you interact with these people as they sort of blend themselves back into life. So they came to a place on the Mornington Peninsula, and I'll show you a picture in a minute, and it's pretty posh. Anyone would like to stay there. But we were incredibly lucky because we did a lot of research trying to find facilities, and the people who ran this facility happened to be 2 emergency service nurses who just loved what we were doing, not emergency service, emergency department nurses who just loved what we were doing, and they got behind us and gave us a wonderful price. But my aim when people walked into that place is that I wanted to see their shoulders go down, and I wanted it to be written all over their face, somebody cares about me. And there was no doubt that when they walked into this place and they saw how lovely it was, that's exactly what they thought. So that was really so important. You know, people talk to us about going to Mount Macedon. No, because while Mount Macedon, Femi, is in a beautiful setting, there's all different programs going on. There's all other noise going on. And it wasn't that beautiful self-contained home setting that we were able to provide. So the clinicians, the absolutely important thing about this program is that the clinicians had to understand the sector. And we had three clinicians, Shannon, Richard, and Sharon, who were absolutely fantastic and who absolutely understood the sector. Shannon is an SES volunteer, CFA volunteer now. He was SES for many years. He's worked for us for a number of years. He's worked in the sector for 20 years. He knows the sector. Sharon has worked for many years across the sector as well in Victoria and interstate, and Richard has primarily worked with police, but they all absolutely understood the sector. They spoke the language. They were immediately relatable. And what we found is this was 4 days and there was 8 strangers came into this room, and I watched them eyeing each other up. Who is this person? What are they going to be? Do I feel safe? And I'll admit that some people walked in, because I was there right at the start to welcome them, and I thought, oh my God, I'm not sure how this person is going to fit, you know, and I left and I felt a little bit sick. But what Shannon told me and what the participants told me they arrived at 10 o'clock on Monday morning. By 8 o'clock on Tuesday morning, they were sharing things with each other that they'd never even told their partners and their families. That's how wonderful the facilitators were at creating a safe space and a safe group, and the participants fully understood what the objectives of the program were. So the program is a 4-day sort of psychoeducation, narrative reframing group work, skills training and practice. It starts off with some theory so they understand how the brain works with trauma. But then it's all about talking and thinking and reflecting. And at the end of the first night, they go back to their lovely room and they have to hand write a story, a long story that they are going to share with people the next day about something that happened to them. I don't want to give too much away because it spoils it for the next participant, but something that happened to them. And what we found was many of them were in tears, ringing their partners and saying, you know, I've never spoken to you about this, and now I've got the time and the space and feel I'm able to. So that's the context of the program. So these are the 8 cohorts of people that went through. So they represent 9 different agencies. The vast majority of not the vast majority, a large cohort came from 000. The next biggest group was from CFA, and the rest was sort of spread between. Now, what we found was that there were some people here participating who came of their own volition while they had days off. They weren't necessarily supported by their organisation. 000 supported everybody to go, but some other organisations didn't work like that. But people heard about this and thought it was right for them and then did it of their own time, took days off or on leave. So that's the 8 cohorts, you know, like a real mixture of people that had never met before, and many of those groups still see each other and keep in contact with each other. Then we've got then this. Oh, sorry, I've just clicked something. Sorry. I've done something here. What can you see on the screen? Lisa, can you tell me?
Yeah, we can see the 6 programs.
Okay, all right. Something else has come up on my other screen. It's not letting me move on for some reason. I had another picture to show. Oh, there we are. So that's the place where they went to down on the Mornington Peninsula. And we particularly wanted something in nature because we learned that in Canada. That was really so important because there was times when the participants had to go out with a buddy and walk and think and talk, and we wanted that environment as well. So that's where they were. So now so what we're here today to do is to understand what we learned from the program, the pilot. And we've got Associate Professor Lisa Dell from Phoenix, Australia, and she's the Director of Research and Evaluation at Phoenix, which of course is associated with the University of Melbourne. And she worked with Ellie Lawrence Wood, who's a Senior Research Fellow, but it's Lisa who's going to be presenting today. So I'm going to stop sharing and Lisa is going to share her slides with us.
Thank you, Susan. Let's aim for a seamless transition.
Yes.
If I can. Okay.
Yeah, that's good, Lisa.
Can you see my slides?
Yes.
Excellent, because I cannot. So let me just open another screen so I can see them. Thank you, Susan, for that context and that background, and welcome everybody who's here today. I can see that there's a number of people online, and this is a really exciting moment in the life of this program, this pilot program, to be able to be here today and sharing the outcomes. We delivered the final report to Susan yesterday, so this is literally hot off the press. I'd like to just take a moment before we begin just to acknowledge those with lived and living experience, many of whom are probably on the line today. So I'd like to recognise the people here today with lived and living experience of trauma, pain, mental ill health and recovery. And I'd like to recognise their strength and that of their families, their carers, their kin and their supporters. So I don't have to go into too much detail around the design of the program because Susan's done an excellent job of orienting everybody to that at the outset. The program, as Susan mentioned, was targeted towards individuals who are in sort of this yellow to orange zone of the mental health continuum. And I just wanted to pop up a diagram that's by Chan and colleagues demonstrating that mental health continuum from sort of a green zone to a red zone. And really this program's intended to be of benefit and be of use for those individuals who are sort of sitting in that middle zone. So around this the general nervousness, irritability, slight impact on work performance and social activity, to those who might have a little more anxiety or anger or sadness or impairment that's impacting their day-to-day living. Getting into the evaluation, so the primary aim of the work we did was really to sit independent to the operations of the program itself. So we weren't involved in the day-to-day running of the program. We really sat outside the program and collected the data in order to assess the impact and benefit that the program had to individuals. So we were there to determine the extent to which the pilot was able to contribute to positive mental health and wellbeing outcomes for participants, done in a self-reported way, so based on surveys that the participants themselves completed. And we were looking to see whether those improvements were sustained over time, so over a 6-month period, which is why there was such a long time between when the program first started and when the evaluation report has been able to come out, because we followed everybody up at that 6-month time point. And we wanted to understand the participant experiences, so what they thought of the program. In designing the evaluation, we had 3 core questions, and I've popped those up on the screen there. So it's really about, to what extent did the program contribute to improvements? Were those improvements sustained over time? To what extent did the program meet the needs of the individuals who it was designed for? And what were the potential cost benefit and impacts to individuals, organisations and the community within Victoria? And we were very lucky to have Findex provide that data for us to consider when we were writing up the evaluation report. So let's get into it. Who was involved in the evaluation? So we had 48 emergency service workers that represented 9 agencies participating across those 6 cohorts. So I've just popped up there for you to see the breadth of organisations that were involved in the pilot. And what did they do? So in participating in the evaluation, there were 3 key time points that we provided evaluative surveys for the individuals to complete. So they did their first survey with us prior to acceptance and attendance on the program. And this survey had a 2-fold purpose. So firstly, as a baseline for the evaluation in order to help us assess change over time. But secondly, it provided the facilitators with information that helped to determine that suitability assessment that Susan was talking about. So that one in particular had that dual purpose. After they had completed the program, so a month after completing one of the residential wellbeing programs, they completed the same survey again, and they also engaged in a post-program clinical review and check-in with the facilitators who had been a part of their group. This included both the individuals who participated and also, where possible, their support person. On the back of that clinical review and check-in, Ellie, who's on the line today as well, Ellie and myself jumped in and ran a focus group. So the clinical facilitators jumped out and we ran a focus group with those participants and their support individuals. We also ran some groups with the support persons on their own, just depending on what worked best for the individuals involved. And then we had this 6-month follow-up that I mentioned. So at time 3, there was, again, the same set of surveys, but also some open-ended questions as well. So we measured post-traumatic stress symptoms, we measured psychological distress, functional impact of those mental health symptoms, social support, quality of life, and presenteeism. And I've made a note there, which I'm sure you've read in the time I've been chatting, about what we asked about in the focus group. So those thoughts, what skills they had put into practice, any observable changes and impacts from the support person's perspective, whether they talked about the program, were they advocating for the program, and also some program feedback around improvements, enhancements to the program, and that ongoing connection with those who'd participated with them. So taking all that together, we ended up with 3 core inputs. So we had quantitative data, which was that survey data I was talking about, and you can see there the numbers who completed those surveys. We had qualitative data, which was that focus group data, and we also had that cost benefit analysis that was undertaken by Findex. So the characteristics of the individuals who participated in the evaluation, and you saw on the previous slide, we had a really high rate of return of the survey responses. It wasn't everybody, but we had a really high rate of return. We had slightly more females than males. The average age was 48 years. We had 77% who were in paid employment, 23% were volunteers, and there were 47% of individuals who had a current mental health diagnosis. And I've just made a note there that no further information was gathered beyond yes or no for that question. So we don't have any more detail around what that diagnosis was, how long ago it was, and what it was in relation to. I'm going to present the good stuff now. So we're going to talk about some of the key findings from the evaluation, but I just put a little tiny note there that the complete findings and our data analysis processes and outcomes, so all of that in the weeds detail is available in the technical report. I don't have time today to present all of those tables and figures. I've got a few key ones that I want to go through, but there's much more information in the final technical report that Susan has. So this slide is our key findings. So it's the summary of all of the analysis, all of the inputs that we pulled together in order to synthesize the main findings of the evaluation. So the first facet that I'm going to talk about, and this one I do talk about in a little bit more detail on the next slides, is around mental health improvements. So the vast majority of the individuals who participated in one of the pilot programs showed significant, so statistically significant, reductions in self-reported psychological distress and PTSD symptoms 1 month after the program, with those benefits largely maintained for the majority, not everybody, but largely maintained at that 6-month follow-up. Broader positive impacts. So we also saw in those other measures that we had around that functioning, quality of life and social support, we saw improvements in those measures as well. So we saw a decrease in impairment of mental health symptoms on day-to-day functioning. We saw improvements in terms of self-reported quality of life. And we saw improvements in the ability to work despite some of the mental health challenges that people were experiencing, which is that concept of presenteeism. There was a really high level of satisfaction with the programs. So they talked about feeling valued. They talked about feeling supported. The location, as Susan showed you, was beautiful and nurturing. They talked about the importance of peer support. So undertaking this program in a group setting, having that peer element. And they talked about the facilitation. So the experts who facilitated the program as highlighted as crucial elements, resulting in a really high sense of satisfaction with what they had been through. Another key finding was around that skill application. So many of the participants in our focus groups and in those written responses at the 6-month timeframe reported a continued use of the skills that they had learned. And particular standouts were around communication, both at home and in the workplace, around the practice of mindfulness, and around self-care practice. Another facet that really stood out and has been drawn out in one of our key findings is this notion of the ripple effect. So the program itself, obviously as a pilot, it targeted a finite number of individuals, so 48 individuals. However, in talking to the individuals and in talking to their support persons, what really became evident was this positive impact, this ripple impact on their personal relationships and their relationships within the work environment. And individuals were talking to us about their capacity to communicate and their ability to support others. So the idea that this would only influence the single individual who participated is not something that is not one of the core findings that we found. We really saw this ripple effect and this filtering in through the individuals' lives. And the cost benefit potential is our final key outcome. So the initial analysis that Findex did suggested that the program could be cost effective compared to the potential workers' compensation claim costs, although we note that a more comprehensive evaluation is probably needed to verify that. And I'll talk about that a little bit later. But certainly the initial data demonstrates some real potential in terms of cost benefit. The next couple of slides that I want to show go into the weeds a little bit more around those mental health improvements. So the first one is around the change in mental health symptoms. So from a global point of view, as I'd mentioned, we found that the self-reported symptoms of psychological distress and those post-traumatic stress symptoms decreased significantly. And again, I use that word with a statistical meaning, so showed statistically significant decreases between before the program and after the program, and those gains that were made tended to be maintained by that 6-month follow-up time point. And what I'm showing here is a graph that shows the psychological distress symptom severity category. So this is measured by the K10, the Kessler Distress Scale. And this shows the change over time. And you can see those 3 time points there. So pre the program, 4 weeks after the program, and at the follow-up time point. And these are the data that was provided, we're able to categorize into individuals who are likely to have no mental disorder, who are likely to have sub-threshold mental health problems or mental health disorder, and who are likely to have probable mental disorder based on this particular scale. So you can see visually there the change over time where we're seeing less people in that light blue and orange category in that graph, and more people moving into that darker blue, that navy blue category. And that's the kind of change we want to be seeing. We want to be seeing individuals being able to report less symptoms of psychological distress after a program such as this. And that's certainly what the data has shown us. The next slide that I'm going to show you is the same measure. So it's again looking at psychological distress, and it's looking at change over time, but this is looking at trajectory change over time. So it's looking at the individuals, how they scored in pre-training according to those categories, and then those 4-week follow-up in that post-training, and then that 6-month follow-up. So this is what we would call a trajectory map. So it's showing individuals who were in those different categories, so no disorder, sub-threshold and disorder, and how they've moved between categories over time. And the reason why I wanted to demonstrate this in particular is looking at some of the individuals who potentially started in more of those yellow, orange, a little bit in the red zones, and I wanted to demonstrate how we've seen some shifts over time. So how the data has shown us that individuals were reporting less psychological distress over time. And for some individuals, that was maintained at that longer term follow-up. So I just thought this was a nice visual way for people to see those changes over time. We can do the same, and indeed we did do the same with probable PTSD. So looking at PTSD symptom change over time. So we've got, again, in that pre-training, we've got individuals, this is a dichotomous one. So this particular measure just categorizes as likely to not have PTSD or potentially probable PTSD. So I stress that this is not diagnostic. This is around probable disorder. And what you can see here, which I think again is a really nice visual, is the change or the those trajectories over time with individuals starting in that more red zone, and we can see some shifts into some of more those green zones, and that those gains seem to be maintained at that follow-up time point. So again, I just thought a nice visual for you to be able to have a look at what some of the self-reported data is saying. And I couch that this is self-reported data. This is not independently clinically assessed. So this is the individual's own perceptions of their symptoms. I apologise for the density of text in this particular slide, but this is a snapshot on that return of investment. So this has been taken directly from the Findex report, and you can see that, and I have really truncated this report and just pulled out a couple of key messages. The full report is available as an appendice in our technical report and goes into much more detail, but I thought that I'll just pull out some of the salient points for today. So initially they had a look at the program and participant costs. So the 6 programs costing a total of just over 200,000 for the 48 participants, and you can see the individual program costs and the per participant costs in that very first bullet point. The next section leans into the Victorian work cover claim costs and draws on publicly available data that speaks to the average cost of a single claim, for example, at Victoria Police, at Ambulance Victoria, and at 000 Victoria. And it's been noted that these claim costs are an average for all types of claims, and that it's important to remember that the research confirms that the average mental injury costs often far exceed physical claim costs. And so these numbers should be taken to be a conservative estimate. Drawing together the data that they gathered and the analysis that they undertook, Phoenix concluded that the residential wellbeing program shows great promise as a cost-effective early intervention, with potential savings deriving from reduced mental health related costs, potentially improved retention, and towards prevented work cover claims. And I just need to note here that the Phoenix Australia evaluation was not able to determine whether the observed program benefits will be sustained in the longer term and will translate into reductions in work cover claims, reduce mental health cost, or improve retention, because we haven't followed these people up for long enough. So we don't know that answer. It certainly suggests that we're heading in the right direction, but that's an unknown at this point in time until longer term follow-up can be undertaken.
Lisa, can I just say something there? We've actually put in a grant with WorkSafe to do that piece of work to understand whether or not this program could be used as an intervention to help improve return to work rates. So that would involve working with the insurance agents and a completely different cohort of people. So they'd be people who were very early on in their work cover journey, and they'd be provided this as an option. And then we would do some comparative work to look at return to work.
Mm. Thanks, Susan. And that's a really good and a timely point you make. I think, we just always need to remind ourselves that this was a pilot. So this was the first look-see to understand the impact and the benefit of this program. And should those impacts and benefits be in the direction that we're hoping for, then this is the first step in probably a bigger and a more rigorous assessment that needs to be undertaken, and that would include the things that Susan was just talking about. So fingers crossed for that next piece of funding, Susan. Okay. I also want to just take a moment to share some of the feedback from the participants, and I want to acknowledge the generosity with their time that they provided to this evaluation. So not only completing those surveys across 3 different time points, but sitting in focus groups with Ellie and myself and with their support person, often while managing the other demands within their lives and their work. I just want to acknowledge the time that they gave to this evaluation and how important that was. And so I've put a few quotes up there that we gathered throughout those focus groups and sought that information with permission to be able to present it. So I'll just give you a second to have a read of some of those quotes. I'd also like to share a couple of quotes from the supporters. So as I mentioned, we had focus groups that not only where we got to engage with the participants, but we actually got to hear from some of their support partners as well. And this is some of what we heard. And there were so many quotes, there were so many really positive and impactful things that were shared with us. This is just a snapshot for you to have a look at. There's a lot more information around this in the report as well. So as I mentioned, one of the things that we did ask the participants about was around this, future enhancements and future opportunities. So if the program were to continue to be rolled out, what were some things that they felt were real strengths, and what were some areas that they thought could be enhanced? And there were some clear themes around that, and that included more opportunities for follow-up gatherings and connections. So these individuals really bonded and connected as the groups, and there was a lot of there was a lot of feedback that they would have liked more opportunity to continue to connect with that group in a social setting. as well. And a number of groups did that. So we heard a number of groups had set up their own WhatsApp groups and had catch-ups and walks and met each other's families. So it really fostered some interagency collaboration and connection, which was really lovely to hear.
And Lisa, I tell you what I found really gorgeous was when we had our Family Matters Expo at the AFL match last year, one of the cohort groups all met there with their families. And, that was just lovely to see.
Mm. It is. It's a very powerful outcome, that connection that was established. Another future enhancement or opportunity that was raised was that it would be great to have an in-person opportunity to reflect and review on the experience with the facilitators. So after the completion of the program and then that 4-week check-in, it was felt that it would be great to just have an in-person opportunity rather than an online opportunity. So that 4-week clinical review and check-in happened online. Where possible, people felt that that could have been enhanced by having that as in person. There was quite a bit of discussion around ongoing communication and provision of resources and access to support in the few months after the program. And I think that what that's reflective of is that the work has begun for a lot of individuals, and there's a sense that it would be really helpful to have a little bit more guidance around how to continue that work that they've started, and also reminders around what they had done in the program, because it's a fairly intense experience in terms of the activities that are undertaken. And so just some reminders around tips and hints over the months that are after the program. It was felt that that would be very useful to have that. So some really great feedback coming out. And again, this is detailed more thoroughly in the actual technical report. And I'm so mindful of time, so I'm rushing a little bit. It's very important that we acknowledge the limitations of the evaluation. It's really important for us to recognise that there was no control group to compare the outcomes against, and that's okay because this was a pilot, but it does make it difficult to definitively attribute improvements solely to the program. It may have been after the program that individuals went off and did other engagements to support their mental health and well-being, and that could be contributing to why we're seeing that sustainment of benefit over time. So we need to acknowledge that as a limitation and just recognise that for any potential future iterations of the program, it would be great to see a more rigorous design. But that's not to suggest that what was done was not the right thing to do initially. It was the right thing to do a pilot initially, but now we need to think about those next steps. The 6-month follow-up period, I've already mentioned, limits our understanding of the longer-term benefits. And we must acknowledge that the sample included individuals with varying levels of mental health symptoms. So despite the program being intended to target those in the orange zone, it did draw in individuals who were more in that red zone. And we need to just be mindful that that could affect the generalizability of the results to any one cohort. We weren't able to tease out those differences in all of the analysis we undertook just because of the small sample sizes. It is something to be mindful of, are those differences. So it's very important that we recognise this was a small group, but indeed it was a pilot. In terms of the recommendations based on our work in the evaluation, given the positive outcomes, it is recommended that the residential wellbeing program continue to be implemented and more rigorously evaluated in terms of the design. So thinking about a control group or thinking about a comparator group, in order for us to be able to determine from a statistical point of view that the benefits that the program is demonstrating can be more strongly linked to the program itself. It's really important to think about post-program support. So considering more structured follow-up, potentially more regular check-ins and skill reminders, that will be something that should be considered for future iterations of the program. I've talked about the further research around more rigorous studies with control groups, and that will help us with a more rigorous assessment of the long-term impacts and cost effectiveness. But something I do want to talk about is the organizational integration. So we need to recognize that well-being doesn't occur in isolation for the individual, that organizations also play a role in well-being and the impact of organizational factors such as work stress, shift work, workload, role overload, that those factors play a role in terms of an individual's mental health and well-being. And we can't consider the individual in isolation of those factors. So we do need to think about organizational integration and how programs like this can fit into broader organizational mental health strategies. So that's a very important piece that I haven't touched on as much in this presentation, but it's something that is very important to consider going forward. I have one more slide, and then I'm happy to take any questions, and I'll hand back to yourself, Susan. From our perspective as evaluators, we feel like the program shows it shows promise as an effective program for supporting mental health and wellbeing of emergency service workers. There's definitely a need for further research, and that's what we'd be really hoping for and very supportive of, further research with a larger population. Certainly the results of this pilot indicate significant benefit for participants with those ripple effects that I talked about, and the potential for cost benefit effectiveness for organisations and other community and organisational stakeholders, such as insurance agencies. And I just want to leave you with this quote. When you're walking into something like this, you're feeling that maybe your organisation has forgotten about you, and to have that feeling, the luxury, I felt valued. And those last three words sum up a lot of the feedback that we heard in regards to individuals' experience in the residential wellbeing program. And I want to take a moment to thank Susan and thank the team who've tirelessly worked to implement this program and bring it to Victoria. It has been a pleasure to sit alongside that passion and that commitment. And we at Phoenix have felt really proud to be able to be involved in the evaluation. So thank you, Susan, and to your team for the hard work that you've done in getting us to this point. I know it's many, many years of effort. So thank you. And I will stop sharing and hand back.
Thank you, Lisa. Look, there's a few people online. Well, if people are thinking of any questions, we will do an e-news, probably go out on Monday, that will have the full report attached to it so you can have a look at it. But Duncan Shields, I know you're online from Canada, and it was your program from over there that we built off, and your generosity. I'm just interested to hear what's your reflection on seeing that come to life over here in Victoria. Would you like to share your thoughts?
Sure. And Captain Steve Farina is on this as well. And he was one of certainly my partner in crime in developing this. I couldn't be more thrilled. Really, this program started as a collaboration and a real belief that if we really rolled up our sleeves together, we could leverage something that was inherent in the emergency services population, that ability to do hard work, the ability to summon up courage, to turn towards the things that are hard to look at, and the ability to have each other's back. And that's really what this program was designed to facilitate, was a phenomenal recovery environment where emergency services workers could come together and support each other and recover together. And so, when we first started conversations, Susan and I, it was trying to really make the point that clinically, the program was not rocket science. It was fairly simple, bare bones. But what was really important was how you engaged with the people who would be the ultimate beneficiaries of it, and how the facilitators would deliver it. It wasn't just the what, it was the how. And so really, I think in the results, you see part of the reflection of how the spirit of that original programming was carried forward. It was translated to current needs or the local needs in Australia, but the way that it was delivered kept the heart and soul of it. And that's really a credit to Susan and Shannon and Sharon and Richard, the facilitators who did this. But it's also a real credit. I think the results really belong to the participants, they worked really, really hard to make that program work. And so they share in the credit. These are your results. This is your data. This is your accomplishment. And so congratulations. I really think it's phenomenal what you've done. It's early. We've had 500 people through our program. Our peer review article is just coming out, but it's still early. And I'm really thankful for how you've used the program and really improved it.
But our results mirror your results, don't they?
Very much so. Very much so. A couple of different measures. But what we found as well is this sort of spin-off results for the family and for the community and for the organization itself. We're saying that really, we know that emergency services workers, train for the crisis, but very often don't train for what happens right after. We don't train well for the recovery period, even though we know what happens just after the crisis is actually where the biggest determinants of long-term well-being come in terms of social support or negative social interactions. And so the program was really designed to help first responders, emergency services workers support each other. And so people come out of the program as ambassadors, not of the program, but of a different way of being together and normalizing some of the impacts of service so that you have the tools, hopefully to put people like me out of a job in the future at some point, so that you've got the tools and the language and the ability to turn towards each other and hold each other up, despite what you see and what you have to do.
Oh, thank you, Duncan. There's a couple of people online that have been in the program. Emma Atkins from Life Saving Victoria. I'd just like a couple of them to bring some lived experience to it as participants. Emma, would you like to reflect on what you heard and your experience of the program?
Thanks, Susan. And whenever I get the opportunity, thank you for driving this one. It's had such a significant impact on myself and those around me. So thank you again. I guess my reflections are I'm not a frontline worker. I support those that are. And so for me, it felt quite undeserving to go along to this. But by going through it, it's a chance to really deeply reflect and be really honest with myself. And that, I probably wasn't where I thought I was. And, the walking wobbly is certainly something that resonates where I was. And the reality is I was probably closer to falling over than I thought I was. You take a lot on and those shoulders are up, and certainly this program allowed me to think about myself for a change and really see how that was playing out in my life, whether it was in my leadership, my behaviours, and certainly probably being how I was towards myself. So this allowed me to really forgive myself and to lower those shoulders. And I have a sustained sense of calm since I did the program. But for me, probably the ripple effect is so obvious to me. You come back not only in your private life and world, but from a work perspective, certainly the ability to role model what you've learnt, and those learnings are really practical. And something clicked inside my head, and I thought, oh gosh, yeah, I can use this, and it's easy to use what we've learnt. So, I think about those that I came back and told my experience to, shared some of those techniques with, and even out of our 8 cohort, if we went and shared that with 10 people, that's all of a sudden 80 people, but the reality is it's probably hundreds. So you're talking about a ripple effect of every program in the hundreds. It's far beyond 8 people. So for me, I couldn't speak more highly of it. I enjoy what we learned every day in my practices with my peers, with family and friends, and a broader organisation of volunteers. My shoulders are certainly down, and for me, you know, the ability to do this program with 8 incredibly you know, amazing colleagues from the emergency services, and to build a network of supportive people around you is just an added bonus that I never thought I'd get from it. So there are a few of my reflections. Thanks.
Oh, thank you, Emma. And there is somebody else online who is frontline, and that's Jackson Serati, who's a paramedic. Jackson, what about you? What's your reflection as somebody who's been part of the program?
Hello, everyone. Can everyone hear me?
Yep.
Yeah, good. Okay. It's really hard to put it into a 2-minute snippet of how much this program has affected me and my immediate family. It's changed my life in ways that I just can't explain. I was one of those people who was most certainly towards the red. I was very, very deep in the orange. And mind you, the average age was, what was it, 48? I'm 31. I was probably the youngest in the entire thing. But I think having that space with other emergency service workers and knowing that you are safe, you have that safe place to talk and to be vulnerable. And I think having that area where it was homely with people that you knew cared allowed me to be more vulnerable than I think I've ever been with anyone else in my entire life. And that in itself should be all the information anyone should ever need for this program to keep going. The ripple effect of the positive changes that have occurred from the negative experiences that I've had to go through is that I was able to be a part of this foundation and do this program, and I am a better human being now on the other side of this program than what I was beforehand. Post-traumatic stress disorder is real, but when I went to this program and the things that I learnt was that the post-traumatic growth is also real, and it far outweighs the PTSD. I'm now currently in a place that's well above on the my little mental health graph. I'm well above from where I was at my lowest point. And to be honest, I'm higher now because of this program than before I had any inkling of mental illness in my life. I've actually become more of a whole than what I was before. It's gave me it has given me the capacity and has assisted me in being able to process negative emotional and positive emotional ordeals in a much more holistic and wholesome way than what I ever did in the past. And I think just due to the amount of vicarious trauma that we build up in the emergency services, this program is, to be honest, I don't even care how much money it costs. Because if it's changing my life this much and the ripple on effect that it has for the people around me, you can't put a price on that. And I just think that literally everyone who has any form of emergency services work should do this program. And I think if we rolled it out, then too many of my friends in healthcare have committed suicide. And I know that programs like this would prevent some of those suicides from happening. I know, because a lot of them are young males who don't have the space that I had in this program to talk and to be vulnerable and to take that really, really hard step to getting better. And I think that a program like this is, like I said, it's priceless.
Thank you, Jackson, and thank you for sharing. There's one more person I would like to go to, and that's Greg Dean, who has shared the passion with me from the beginning. Greg, how do you feel today? We had a dream. It's unfolded. We've done the pilot, and by all accounts, we've got amazing results. It's that, set us in a good place for going forward. What's your reaction to that? How do you feel today?
Well, I don't know how I'm going to follow Jackson for a start. Congratulations, mate. That's really impressive, and it's great feedback. Look, Susan, you asked me just to give a couple of reflections, and I suppose my journey really started maybe 8 years ago when I first got my Churchill, and I suppose I look back on the memories and the experience I got from the Churchill along with the ESF scholarship, and sort of the friendships both professionally and personally that you get through those opportunities was, for me, life-changing. And look, many of those are tuning in today, so it's because of a lot of those people as well that we find ourselves where we are. Two of the 14 recommendations I came with and went to Mr. Ashton with were probably the two of my most passionate ones. Was a holistic wellbeing retreat, in brackets the residential wellbeing program, and improved family education. So those two recommendations have come to fruition with the assistance of the ESF. So that's not lost on me either. So that's really impressive. And you already mentioned, one of the thank yous I do have is for Mr. Ashton for introducing me to you, I suppose, because if he was trying to find the best person to drive the car, he certainly found that person being you. So it's there's some of my long-term reflections. I suppose on a shorter-term reflection, I think we need to, and Jackson sort of summed it up a little bit as well as Emma did, is that I just wanted to acknowledge the courage and the vulnerability of all the participants in the program, because it's because of their stories and their ability to be there and put themselves out there, I suppose, has allowed us to be where we are today. So I think that's really important to acknowledge. And I think I've said this to you before, Susan. It's sort of not lost on me that what we've been able to create is probably a first for Australia, most definitely for Australia, and maybe even a world first, in that not only have we developed a program that's from an early intervention perspective, and it actually has been designed for the entire emergency services sector, and it also has involved significant others or support people. And in my experience, I haven't come across that sort of model before. So that's not lost on me either, that, we've probably broken some pretty big ground. Yeah. So thank you.
Thank you, Greg. And Greg mentioned, or somebody mentioned online about getting together, and there's about 50 of the participants and their partners getting together tonight, which will be wonderful. Steve Farina, my dear friend from the professional firefighters in Canada, I'd just like you to finish up, because, you went to Duncan and you said to Duncan, too many of our friends in the fire service are sick and too many of our friends have suicided, we need to do something help. And now here you are speaking to people in Victoria because we've taken that idea and done our own thing with it. How does that make you feel?
I was just texting Duncan. I feel so profoundly proud to see this program that we created go international. And, Duncan mentioned we've had over 500 first responders come through our program, and we've literally transformed the culture across Canada. And, to hear the testimonials, what you said, Jackson, it embodied our why. This is why we do this, man. Shoulder to shoulder, nothing for us without us. This is true collaboration, and this is what destroys stigma. That courage to be vulnerable is such a beautiful thing. So I'm profoundly proud to see what you've done with the program. I think you've taken it to the next level. I think we need to level up, Duncan. And it's validating. It's validating. The results are the same. And your workers' comp data, not only is this the right thing to do for the people that are on the front lines and their families, there's a return on investment. And so there's value here. On a 3.5, 4-day program, where do you get that kind of value? You just don't. And it has been transformational. It's been transformative in, like I said, coast to coast. I have friends across Canada that have come through these programs, and it's literally saved and changed their lives and gone home, and their families have like I saw the testimonials that you had. It's a beautiful thing. I got my husband back. I got my dad back. I can be a father again. I can be a mother again. Like, this is the impact that you're having. And so to me, it's like we've created something so beautiful, and I love to see this going international. So thank you for allowing me to speak about that. I could not be prouder.
I'm glad we're not in the same room, Steve, or we'd both be crying. I know that.
Oh, yes.
We look, I need to finish up, but there are some people I want to thank that came on this journey with me. And that's, Graham Ashton. It was that first conversation that we had. It was Greg, meeting Greg and sharing the passion with Greg. It was Amanda Smiley from VicPol, who did a lot of work in the early days. It was my wonderful Naomi behind the scenes, who did all the admin work for the program. It was the member agencies who supported the initiative, and you know who you are. It was the participants who trusted us with something new, because we deliberately did not tell them what they were going to be doing on the program before they arrived. And they just walked into that program blind, and they trusted us. And of course, their support people who were there when they came home. Our facilitators, Shannon, Sharon, and Richard, who are so invested in this program. As counsellors and psychologists, they say that it's the proudest thing they've ever done in their careers. Duncan, of course, from University of British Columbia and Blueprint, so generous, and in working with us and mentoring me, I suppose. Steve, for being an advocate and supporter and initiator. The board for trusting me to do this. The mental health advisory group, who were there with their clinical advice and really, made us do this properly, and at the time I was spitting chips, but they actually made us do it properly, and I'm very grateful of that. And of course, the funders, who without them we couldn't have done it. The people who donated to Tony's Trek, EML, the insurer, WorkSafe, the state government through the Emergency Responder Mental Health Program, and in the early days, the Motorola Foundation. So look, I think without question, the program is very beneficial and cost effective. $5,000 per person compared to the cost of a claim. So now the next uphill part of the journey begins to make it accessible to all who need it. And I can assure you, I'm going to be driving that car. Somebody referred to a car before. I'm going to be driving that car, and I am going to, really work hard to make sure that happens. But now I'm going to sign off, and I'm really looking forward to meeting people tonight and celebrating what you brought to this program. So thank you everyone for your time, and please look out for an e-news from us on Monday where we will connect you to the full report. Thank you for being with us today, and thank you to Lisa and Ellie for a fantastic report. Thank you. Stay on, Steve and Duncan.
Oh, that was beautiful.